The eye clinic, and in particular the pediatric clinic, has to be supported by orthoptists, optometrists and other allied medical professionals. It is team effort really what makes a successful working relationship from the point of view of knowing that we will be able to produce a good quality of care if everybody is doing what they are good at.
Before many clinics, we will have a discussion about which patient is required for which service to ensure that the clinic workload is as streamlined as it can be.
I think that obviously the team has to trust each other. Communication amongst the team members is key. There may be sometimes when we may disagree or have a little bit of a difference on something, but obviously to try to iron that on the day.
In terms of being able to have a good working relationship, I certainly say with preparation and flexibility would certainly assist in a lot of the understanding between the different professions that are in our eye clinics.
I think that we're quite lucky having a bunch of really fun people to work with, excellent professionals, very passionate about what they do, and that passion really shows off on the quality of care that you give to patients. Optometrists
do offer a very useful profession because there's training in assessing the structure of the whole eye, and also the ability to be able to interpret the other eye assessments such as visual fields, and particularly with OCT technology coming in nowadays. The population is growing, there's more demand for services, and I think that certain clinics are passed on to community and to hospital optometries. Roles that were traditionally given by a doctor, ophthalmologist, will be and are at the moment being passed on to optometrists and orthoptists. I've been very fortunate. I've worked in Scotland under the Scottish eye care system, so I've been able to see the primary eye examination and the supplementary eye examination work hand in hand. The extended role is something that I can, well, it is happening, and I can see it happening even more in the future. So certainly not think of yourself as an island, and become connected with that local support network. The major breakdown in communications is not receiving any feedback from what's happened to any patient that you refer onwards to secondary care. So that's something which I've been trying to improve upon for patients that come through our clinics. It is very important to respond back with feedback of what happened, and most of them are very supportive. Most of them say, yes, you made the right decision, and that is very encouraging for that clinician who's working more individual setting. Then it gives you a contact, so you contact that person on that letter, say, you've sent me this letter back, I've referred this patient in, is it possible for us to meet, to come and visit, come and see what happens there, and spend some time. From my experience working in community optometry, being able to contact a certain specialist is quite a daunting prospect. So it is a very difficult path to initiate. I think certainly it's not unusual in the time that I've been qualified to consider some ophthalmologists as being completely unapproachable. They are seen as being so experienced, with lots of demands on their time, that in order to see somebody that they are not familiar with is considered to be actually an impossible task. I would certainly disagree with that comment, because in my experience I've worked with some very approachable clinicians who have lots and lots of patience and lots of time to communicate with somebody that is genuinely interested in delivering a service which is going to help. I would say that the first line of communication is to directly contact that clinician and express your interest. And it may not be that you get to meet that person, but you can meet the team that person leads, and that can then extend to different ways of examination in your own individual service.